He's making the right decision, and we applaud him tremendously. We're going to hear from our man, the man who's so generous and kind and thoughtful and handsome and suave.
Modest as well.
I think I'm talking about James Bond. Here's that man.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
Hey, we're back.
We are back.
John, are you back? I didn't go anywhere.
No, we sat right here.
We're here. We're talking about this next case, and the next case is so interesting, and it proves that I can do mathematics.
Okay, let's hear it.
How does a doctor do mathematics?
Basing results, putting successes
results
into his
Okay, you can
practice.
do that. You can do the data management. We do the data. We follow thousands of patients.
And I know you guys are on top of that, more so than most practices that I've ever seen.
That's correct. We have the data, and hopefully we'll get to some of the new data that we've just put together. Anyway, this is a 44-year-old woman from Virginia who comes in for treatment. She has cholangiocarcinoma, which is a cancer of the bile ducts. It's metastatic, which means it's stage 4. She has 8 kids and a loving husband, and she's fully functional. If you saw her, you'd say, wow, she's looking like a normal woman. That's how we want a patient, of course.
Yeah.
So we treated some difficult spots in the past, and now she's chosen to go on chemotherapy. She came in with a new scan of her body, and the scan said everything is stable. I said, well, can you just tell me, how was that metastasis to the lung that we treated last year? Can we just, instead of having a report where it's talk about everything is stable, let's go measurement size by size, tumor by tumor, right?
Break it down,
Break it down. I want to know how my treatment's working to be able to tell her, because I told her, I think we can make your tumors stop or shrink most likely. And I can never promise anything.
Yeah, of course not.
Because if you're a doctor,
I'm sure you wish you could.
And you're prudent, you wish you could, but you want to be honest.
Yeah, sure.
So you can't promise things you can't deliver. But if your success rate is 90%, you can say most likely.
We have a good shot at this.
And it's not only 90% for 2 weeks or 6 weeks, but in radiosurgery, that's the definition. In our hands, and we were the first ones to do it with the longest experience in America for body radiosurgery, for the rest of the life of the patient, where we am the beam. So I said, give me the measurements of these tumors. So I measured the tumors, and the report just said everything's okay, stable. But then we found the tumor we treated was 1.1 centimeter in diameter before, biggest diameter.
When she walked in?
When she walked in for treatment last year. And it's now 0.7 centimeters.
Wow.
So it's gone from 11 millimeters to 7 millimeters, okay? Now you can say, I don't know, is that a lot to you or not?
Well, I mean, it's a significant amount.
It's the right direction, right?
Yeah, I mean, yeah. If it's going to move at all, I want it to move in that direction.
Okay,
for sure.
so you're not sure it's a lot. You're not sure, right? You're not sure. So let's do the calculation of the volume of cancer cells in there.
Okay.
If you have a mass that's 11 millimeters, which is about half an inch, a little less than half an inch, and it goes down to 7 millimeters, so it's almost, let's say, a quarter of an inch. If you do the calculation of the cells, the proportion is to the third power of the radius. Okay, so radius is half the distance from the center of the mass to the edge.
Okay.
Right? That's a radius.
Right.
Like a hand on your watch from the center to the edge.
Right.
Okay, so you do multiply it out to the third power, which means in this case it's 0.55 times 0.55 times 0.55. That's what it was. And then you have the current measurement, which is 0.35 times 0.35 times 0.35. And what do you find? That the mass has shrunken in 4 months by 70%. It's 70% smaller.
That's significant.
Okay?
When you break it down like that.
70% smaller, okay? And that's with just one follow-up. With body radiosurgery, most likely the cancer gets smaller and smaller and smaller with time. So I called up her and her husband. I said, I just want you to know something about that tumor that we treated. Do you want to see if what we do really works? I said there was only one tumor, only one cancer that shrank. And that was the cancer that we treated with body radiosurgery. So it's a test. What works better, the chemo or the body radiosurgery? And here you have proof in this patient. We were able to shrink the cancer by 70%. Chemo didn't shrink it at all. So isn't that proof nice?
Yeah, that's what you want to see. Yeah.
She was so happy that we took the time, we did the work, we did the calculations, we treated her. Treatment took 15 minutes. She was out the door. Zero side effects. Zero side effects. None. Zero side effects. Zero. None. And the cancer shrank by 70%. And most likely when she gets the next scan, which will probably be springtime, June, it will shrink even more. So, and she was going to get her lung removed. Her doctors her surgeons wanted to remove the whole lung. I said, don't remove the whole lung. I can hit that. I can most likely stop it.
Yeah.
And she is happy now. I'm happy because what I postulated to her last year came true.
Yeah, that's wonderful. Good news.
Was fantastic. Fantastic. So, here's a news article from The Guardian, which is one of the leading newspapers of UK, right?
That's right.
And what are the headlines? Worldwide cancer cases expected to soar by 70% over the next 20 years, from 14 million cases in 2012 to 25 million. Wow. Wow, wow, wow. So cancer cases are expected to increase by 70%. This is worldwide, not the United States, worldwide. Now, the richest countries are going to struggle to cope with taking care of the costs of health care and caring for patients. And obviously, we have baby boomers who are getting in the difficult years.
Sure.
So we in the health care field need to be ready, and we are ready. We even promised to see people within 24 hours. Now, we're not going to see all these patients within 24 hours, but if you need to see us within 24 hours, you are welcome to call us at 212-CHOICES, 212-CHOICES. Now, in 2012, there was 14 million cases worldwide. Most of these are in so-called third world, poor or intermediate countries, which the United States is not considered a poor or intermediate country. Of the 14 million cases, there were 8 million deaths. So about half the people worldwide with cancer have died. In America, the death rate is much less. So more people are getting access. Most people are diagnosed earlier, and most people are cured. But lung cancer will remain the most commonly diagnosed among men and the biggest killers. 23% of cancer deaths are from lung cancer. So again, stopping smoking is so critical. And actually, lung cancers have decreased in America. Breast cancer is the most common diagnosis in women, 25%, but causes 14% of deaths. So most women are actually successfully treated with breast cancer, which is the opposite of lung cancer, which is why we have to be more aggressive. We have to be aggressive with every cancer. And there's early diagnosis for lung cancer. So for smokers, there's screening to find cancers before they spread. And the other deaths in women and men are bowel cancer. Men, prostate is a leading cancer, and stomach cancer are very common. Now, what's preventable causes of cancer? Well, alcohol, obesity, and physical inactivity. So if you can stop or cut down on alcohol, I don't know if you have to stop, but probably cut down on excessive. Stop smoking. Get your weight down and exercise. You'll probably be in pretty good shape.
Better shape, yeah.
You'll be in much better shape and decrease the cancer risks and actually extend your life. So this is from The Guardian this week, and we always promise to get the latest news for you this week. What do you think about that?
It's interesting stuff. I mean,
it's interesting stuff.
Every week, I'll tell you, Doc. Every single week, I learn something new.
And I just got a call from California yesterday.
Okay.
So a patient out there went for treatment with an acoustic neuroma. Acoustic neuroma is a benign tumor on the hearing nerve.
Okay.
The patient was treated at one of the biggest, most famous universities in California. They were left with facial paralysis. Do you know what facial paralysis is?
Does that have to do with the movement in the face?
Yeah, well, it has to do with the movement not moving, paralysis.
Right, the lack of movement.
Yeah, it's lack of movement. So you've probably seen people on the street and their mouth is drooped down, right?
Right.
And their eye is drooped open. And when they smile, one half of the face makes a smile and the other half doesn't move.
Right, it stays put, yeah.
So it's really sad.
Yeah.
So this patient was at a big surgical university in California, in Los Angeles, had acoustic neuroma, which is a benign tumor, had surgery, was left deaf in that ear, facial paralysis. Now they're trying all kinds of nerve transfers and nerve procedures and more procedures to try to get the face to look somewhat normal. We this week had a patient who flew in, a Cuban man, flew in for treatment, came in, he's 35 years old, came in with his girlfriend, who's beautiful, he's handsome, he runs a cigar-making company in Florida now.
Sure.
He's about 35. He's had an acoustic neuroma for a couple of years. He's been so reluctant to get treatment because he doesn't want to have facial paralysis. He doesn't want to be deaf. He doesn't want to be incapacitated.
Yeah, sure.
He runs his own business.
He wants to keep living.
He can't go out for 6 weeks or 6 months and go to a nursing home and rehab. And he has to meet the public. He came for treatment. He had 5 treatments. We have the world's largest experience treating acoustic neuromas with fractionated radiosurgery. We give the lowest dose, which means lowest dose means less side effects. The secret of success. Here's the secret. Low dose, fractionate the dose, no pins in the head, no cutting, no bleeding. We have the data over 20 years with a 97% success rate. And the likelihood of damage to the face is nearly zero. And most patients keep their hearing, and some patients even have improved hearing.
Really?
With fractionated radiosurgery. And I was thinking on the other coast, this poor woman who has deafness, facial paralysis, multiple procedures to try to get her face going. She has a cup of soup or a coffee, and it falls out of her mouth.
Yeah, sure.
It's calamity. Her friends don't want to speak with her anymore. You can say what kind of friends they are, but they don't know what to say.
Yeah,
her life has been so changed.
Sure.
This man left us. He brought me a bottle of wine. He was so happy. A patient brought the gift to the doctor. Wow. I was embarrassed to receive it, but he was so happy. His experience was so good.
Good.
He had the treatments, no side effects, no complications. He's going to go back home to Florida. He actually went last night. He had his 5th treatment yesterday morning. He went home to Florida and resumed his normal life.
Great.
And he had a week of sightseeing in New York.
Yeah, got a little trip out of it.
No side effects.
Good.
No hair loss, no bleeding, no bloodshed. So, we are going to hear from the man who is so nice and so kind and so thoughtful. When women walk across the street, he holds their hand.
They take double looks. Doc.
They hold their hand. He helps them. He helps people. He's incredible. I saw him last week. He had a patient who was sick, put him in a wheelchair. He took the patient up to the street himself and got a taxi for the patient himself. He's incredible. And you know what? He's going to tell us about Radiosurgery New York now. 212 choices.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. At Radiosurgery New York, the radiosurgery pioneers, that's our goal too. We're first in America, first in New York, first for you with body radiosurgery. We hit your cancer from head to toe with no cutting, no bleeding. We have decades of experience with primary and metastatic, large or small cancers. cancer treatment with possibly a second chance for you. Even if chemo, radiation, or surgery